Okay, well, thank you again, everybody, for joining us. Our first talk today. I'd like to introduce Abby Armwood. She's a PhD candidate and aquatic pathologist at the University of Georgia under the direction of Dr. Al Camus, in conjunction with Dr. Matt Griffin at Mississippi State University and Dr. Mark Fast at Atlantic Veterinary College. Abby's research focuses on Edwardsiella species in Teleos with an emphasis on the United States catfish industry. Abby is scheduled to defend her PhD this fall and has accepted a position as an assistant clinical professor in anatomic pathology at the North Carolina State University College of Veterinary Medicine, where she hopes to continue with her interest in fish pathology and looks forward to further collaborative work with her fish health colleagues. So Abby, good luck on the defense. Congratulations on the job, and you can take it away.
Sounds great. Hey, everyone, and thank you for the introduction. And I'm excited to present part of my PhD research today that was done in conjunction with University of Georgia and Mississippi State University under my co-PIs, Dr. Al Camus and Dr. Matt Griffin, on the comparative immune responses to Edwardsiella ictuluri challenge in vaccinated and non-vaccinated channel and channel blue hybrid catfish. Make sure I can advance my slides. Here we go. All right. The catfish industry is the largest aquaculture industry in the United States, with total sales in 2021 equaling $398 million. The highest producing states are concentrated in the southern United States, primarily in Mississippi, Arkansas, and Alabama. Though it's one of the largest aquaculture industries in the United States, it faces many challenges that other industries do too, including competition from foreign imports, high feed and energy costs, more profitable land use alternatives, and also losses from infectious diseases. There are a number of important infectious agents that cause disease in cultured catfish. One of the most important in fingerling producers are the Edwardsiella bacteria. The Edwardsiella are gram-negative facultative intracellular bacterial rods from the family Hafniaceae. As of the mid-2010s, there are now 5 species within the genus Edwardsiella, including Picicida, Angularum, Tarda, Hoshinae, and Ictuluri. Only 4 of these highlighted in red are important in fish disease, with Picicida and Ictuluri being important within the catfish industry. Edwardsiella Picicida is important in market-sized hybrids, and Edwardsiella ictuluri is the causative agent of enteric septicemia of catfish, which predominantly causes disease in channel and hybrid fingerlings, with channels being more susceptible than hybrids. The disease typically occurs in late summer, early fall, in accordance with the appropriate temperature range for this disease, and it can cause significant economic loss, both through the loss of feed days and through loss of fish in mortalities. Current management includes feed restriction to minimize exposure to the bacteria via ingestion, the use of antimicrobials, and also recently a live attenuated E. ictuluri vaccination. Edwardsiella ictuluri can affect either through the olfactory epithelium or the intestinal mucosa, with the former leading to a granulomatous meningoencephalitis and the colloquial hole in the head lesion, and then the latter leading to a bacterial septicemia. The catfish that survive infection can either clear the infection and become resistant, they can develop chronic disease, or they can become asymptomatic carriers. These photomicrographs demonstrate chronic granulomatous inflammation with intracellular gram-negative bacterial rods, which are common lesions that are dispersed through fish in chronic disease. The Edwardsiella vaccine is a live attenuated E. ictuluri isolate that was attenuated through serial passage with rifamycin. The vaccine is delivered to catfish pondside via an oral delivery platform that's pictured in the image on the right of this slide. The vaccine has been widely adopted by fingerling producers, with 83% of farmers using them by 2020. And interestingly, recent studies done by the group in Dr. Griffin's lab have revealed there's potential cross-protection of this vaccine in both channels and hybrids against the other commercially important Edwardsiella Picicida, And this suggests there may be some potential to look at these different Edwardsella species and use them to develop cross-protective vaccination. The three commercially important catfish varieties in the Southeast United States industry are blue catfish, channel blue hybrids, and channel catfish. Blue catfish are resistant to a number of the diseases I mentioned earlier. Unfortunately, they have a slower growth rate, lower feed conversion rate, and are slower to mature, making them less than ideal for production fish. In contrast, channel catfish are more susceptible to some of these common diseases, but they have a faster growth rate and higher feed conversion rate, and therefore they're a popular produced fish. A hybrid of these two fish become resistant to many important diseases, including ictularia. However, with the emergence of hybrid production, we've actually had the emergence of Edwardsella piscicida, which hybrids are more susceptible to than their channel counterparts. However, hybrids have a really fast growth rate and high feed conversion rate, so they become very popular among producers. The differences in variation between hybrids and channels between the Edwardsellas, including ictularia and piscicida, is not really understood and hasn't been investigated really. The host pathogen responses between these bacteria and the fish is poorly understood. So this study compares the susceptibility and immune responses to Edwardsella ictularia challenge in these different catfish with vaccine status. All right, approximately 5.5 gram channel and hybrid fingerlings were stocked into 24 different aquaria, 12 for channels, 12 for hybrids, with 20 fish per aquaria to assess mortality. And there were 3 tanks per treatment group. The fish were divided into 4 different treatment groups between vaccine and challenge status to assess mortalities. And this layout was mirrored for sampling tanks, with the only change being 55 fish were stocked per tank, allowing for some room for sampling. Fish were vaccinated via immersion with either bacterial broth or sham vaccinated with sterile broth. The estimated bacterial dose of this vaccine was 2.3 times 10 to the 8 colony forming units per milliliter. The vaccine was administered by turning off the water flow to these tanks, putting in 100 milliliters of either sterile or bacterial broth. The fish bathed in that for 30 minutes and then water flow was returned. And at 28 days post-vaccination, serum was collected from a subset of these fish for relative IgM quantification. And fish were challenged at 33 days post-vaccination by an intracoelomic injection with Edwardsella ictularia. Dose was approximately 3.59 times 10 to the 3 CFUs per fish, or sterile BHI as a control. Morbidity and mortality was monitored twice a day with these fish, and at peak mortality at 5 days post-challenge, which was 38 days post-vaccination, the posterior kidneys were sampled for looking at transcript expression. At 28 days post-challenge, serum was again sampled for IgM quantification, and this is when the study was terminated. Relative IgM was measured using ELISAs against both Edwardsella ictularia antigen and piscicida antigen. Posterior kidneys were collected and RNA was isolated and cDNA was synthesized to do Illumina RNA sequencing and subsequent qPCR validation of the RNA-seq data. Bacterial presence was also verified from the cDNA collected from these kidneys, and no bacteria were identified within non-challenged fish or vaccinated challenged fish, but bacteria were present in all non-vaccinated challenged fish. To further confirm the challenge, bacterial presence and identity was confirmed in kidneys from collected moribund or fresh dead fish. And this quantification was all done via an Edwardsella species-specific multiplex PCR that can differentiate properly between the different Edwardsellas and it can correctly confirm the species. ELISA plates were coated with lysates either of ictularia or piscicida, and the antibodies used were a mouse IgG anti-channel catfish IgM monoclonal antibody, the 9E1, followed by a goat anti-mouse IgG secondary antibody. At 28 days post-challenge, cumulative mortality was significantly lower in both the vaccinated channel and hybrid catfish when compared to their counterparts. There was no significant difference in mortality between channels and hybrids of the same vaccination status. These Kaplan-Meier figures demonstrate survival probability in vaccinated and non-vaccinated channels on the left and hybrids on the right, demonstrating obvious protection of the vaccine. Mortality is predominated within the first 15 days post-challenge, peaking at 5 days. And in the non-vaccinated fish, mortality was at or approaching 100%, which complicated some of our sampling later at 28 days in those groups. There was no significant differences between the channels and hybrids when comparing non-vaccinated and vaccinated. The vaccine gave high relative percent survival, which was 87.7% in channels and 93.2% in hybrids. And again, this was not significantly different, and this is great protection in both channels and hybrid catfish. Serum IgM at 28 days post-vaccination at 1 to 320 dilutions against E. ictuluri antigen revealed significant differences in relative quantity between vaccinated channel catfish and non-vaccinated channel catfish. No difference existed between hybrids and their non-vaccinated counterparts. And interestingly, channel vaccinated catfish had significantly higher levels than vaccinated hybrids. At the same time point against E. piscicida antigen, the same results were mimicked, with channels having significantly more in their vaccinated than their non-vaccinated. And again, channel vaccinated having more than hybrid vaccinated. These are from 28 days post-challenge. So this is after both vaccination and challenge, comparing to non-vaccinated, non-challenge. And in this group, channels had significantly more when they were vaccinated and challenged than the non-vaccinated, non-challenged, and same with the hybrids. They had significantly more than their non-vaccinated, non-challenged counterparts. At the same time point, when comparing to E. piscicida antigen, the channel catfish were the only ones that had significantly more in the vaccinated challenged than their non-challenged, non-vaccinated counterparts. And again, they had significantly more than the same group of hybrid catfish. qPCR analysis generally revealed relatively increased transcript expression of interferon gamma, tumor necrosis factor alpha, and interleukin-1 beta in challenged fish compared to non-challenged fish, regardless of vaccination status, often with higher levels in the non-vaccinated challenged fish when compared to vaccinated challenged fish. So next, I'm going to dip a little bit into the RNA-seq analysis, going by infection group, vaccine group, and then comparing the species of catfish. So this Venn diagram is a global transcript expression profile showing the distribution of differentially expressed genes between challenge statuses. And there were high numbers of differentially regulated genes, especially when comparing non-challenge sham vaccinated fish to their challenge sham vaccinated counterparts, with the most being in the hybrids with over 6,000 differentially regulated transcripts. In channels that were sham vaccinated, when comparing challenge fish to non-challenge fish, the challenge fish had increased expression in pathways of innate immunity, the complement system, coagulation cascade, ribosome biosynthesis, and also other metabolic processes, amino acid activation. In hybrids of the same group, they had similarly increased innate immune response and metabolic processes. They also had increased apoptosis, but in contrast to the channels that we saw, they actually had decreased expression of the complement system and coagulation cascade when compared to their non-challenged counterparts. The factor changing in this slide is vaccination status. So previously we were looking at non-vaccinated fish, and now we're looking at vaccinated fish. So in channels, there was upregulation of the innate immune response in challenged fish versus non-challenged, and also cytokine signaling. And those upregulated pathways were mirrored within vaccinated hybrid fish. This Venn diagram shows the distribution of differentially expressed genes when comparing vaccine status among challenged fish. There was no difference in upregulated genes when comparing the non-challenged vaccinated fish to their sham vaccinated counterparts in either channels or hybrids. And while at one time point there probably were differentially expressed genes, at this sampling point, we're now 38 days post-vaccination out. So it's hard to directly compare some of these things, but at this time point, there were no differentially expressed genes in those fish. In challenged channels, when comparing non-vaccinated to vaccinated, there was upregulation of the complement system, coagulation cascade, innate immune response, and other processes. Again, you can see a theme emerging. And in hybrid challenged catfish, they actually had downregulation of the complement system and the coagulation cascade. So now to compare the fish varieties when looking at the different vaccine and challenge statuses, there was a variable number of differential regulated genes lower than the other comparisons that we had, specifically within the challenge vaccinated channels and hybrids with only 2 upregulated genes and not many of significant pathways. When comparing the non-challenge sham vaccinated fish, hybrids actually had increased expression of the coagulation cascade and complement system. And similar findings were seen in our vaccinated fish again, which makes sense because we didn't see really significant differences between those 2 groups. In challenge sham vaccinated fish, there was actually decreased expression of coagulation and complement system when comparing hybrids to channels. And as I mentioned earlier, there weren't really significant pathways that were altered with the challenge vaccinated groups. So in conclusion about infection, increased antibodies against E. chloride and E. picecido antigen were present in channels and only E. chloride in hybrids. E. chloride infection results in severe overexpression in the non-vaccinated fish, and coagulation and complement are important factors in how fish respond to this infection, and it's upregulated in non-vaccinated challenge channels versus downregulated in non-vaccinated challenge hybrids. Challenges in vaccinated fish revealed upregulation in immune genes. There are a few limitations to obviously acknowledge in this study. One is the challenge route, which was intracelomic in this study, which doesn't exactly mimic the natural infection route, but was used in the study design to compare to Edwardsella picicida, which requires intracelomic injection to get the most reliable challenge routes. Also, sample size can always be limiting, especially in the groups where we had high mortality, therefore precluding sampling in some of those groups. When comparing vaccination status, the vaccine does confer significant protection against E. chloride in both hybrids and channel catfish. Increased antibodies against E. chloride and E. picicida antigen were present in catfish, but not the hybrids. And there's variable regulation and coagulation cascade and complement system with the challenge, again, upregulated in non-vaccinated channels and downregulated in the non-vaccinated hybrids. Finally, when comparing fish variety, channel catfish had greater serum concentrations of IgM than hybrids did. Again, with post-vaccination, both E. chloride and picicida and post-challenge against E. picicida, higher transcript expression in non-challenge hybrids compared to channels in coagulation cascade, complement activation, and then the reverse when the fish are challenged. There's some additional work to do on this project yet, digging deeper into the RNA-seq analysis and then validating those RNA-seq findings with additional genes of interest, including some from complement and coagulation to verify the results we saw, and also to correlate histopathologic findings with our RNA-seq analysis. And I think this project alludes itself to additional research that can be really exciting. As another part of my PhD, I did the similar study But looking at Edwardsiella piscicida and the different host responses to Edwardsiella piscicida, so stay tuned for that. And I think it would also be interesting to look at the potential cross-protective effects of other Edwardsiellas that can evoke minimal disease in catfish, such as Edwardsiella angularum. So I think there's a lot of opportunities to learn more about these in catfish and how we can use them. I have a lot of people to acknowledge for this project, many of which are on this call, and I'm very thankful for you all. My PIs, of course, and my committee members, members of the Griffin Lab, members of the Atlantic Veterinary College group with Dr. Mark Fast, and of course, the University of Georgia. And I'm very thankful for the Fish Health Seminar organizers for allowing us to share our research. And at that, I will take any questions or suggestions that anyone has. Thank you.
Great, thank you, Abby. Excellent presentation. Folks, we'll open it up to Q&A. If you've got questions, drop them in the chat box, or you can unmute yourself and ask Abby directly.
Hi, Abigail.
Yep.
Hi.
Go for it.
Great presentation and great research. It's awesome that someone is doing at last some responses post-vaccination and post-challenge post-vaccination. With your IgMs results, it looks like the IgMs play somehow limited role in the immune response and protection.
Yes.
Can you maybe tell something about the antibodies on mucosa, so IgTs or IgZ, whatever, how they are called? Did you see anything in your RNA-seq which was upregulated?
Not so. The only thing associated with humoral immunity that was really upregulated was associated with complement factors. There wasn't anything that we've seen yet that's related to more adaptive humoral immunity, more the innate humoral immunity. And we did collect mucus from these fish, but we have not analyzed it yet. And that's a potential future project, and it's definitely an interesting point. I think one challenge that we have with this study for looking at mucosal immunity is just our exposure route. So with natural infection, the fish are being exposed in the water and on feed, but in this, we've surpassed that mechanism. So it'd be interesting to see in perhaps like an immersion challenge or something like that and look at mucosal immunity, but that's a good point.
Keep on great work. Thank you.
Well, thank you.
Any other questions out there? All right, Abby, you got a compliment in the chat box. Be sure to check that out.
Thank you.